it's been a lifesaver for us. We provide medical, dental, and optometry care to low-income, underinsured, and uninsured adults and children from across the Metro Lansing area. In the last year, we had just under 4,000 patients and provided about 12,000 office visits. We see everything that you would expect to see in a primary care office, diabetes, hypertension, etc. But then there's also a disproportionately large number of patients that we see who come to us for their mental health, where we treat their bipolar disorder, their depression, their anxiety, their PTSD, schizophrenia. A lot of these folks don't have access to psychiatrists, and so the responsibility falls on us. We're sort of the last line of defense for a lot of our folks for their mental health. Primary care in general is about relationship building. We went into this field because we enjoy, following patients over time and helping them improve their physical and emotional well-being. That's really what brings us joy in primary care. And so the providers and the staff here do a really good job of building that trust in those relationships, because without that underlying trust, a lot of the patients wouldn't come back. I found that many of the patients we serve already have a distrust of the healthcare system broadly. And so when we're able to talk to them in a way that builds that trust and that confidence, then they're able to feel good about the recommendations that we make to them to help improve their health and well-being. Without that trust in your provider, you might not be inclined to follow through with those recommendations. The Blue Cross Blue Shield Safety Net Clinic grant has been huge for us because it has been something that we've relied on now for many years to help us meet the needs of the community. We are the second largest safety net entity in Ingham County. The only entity larger than us is the health department. And this has been a really important cog in our wheel to help us serve those who need it most. The cost of care continues to rise in general across the country, and Medicaid reimbursement, especially in Michigan, compared to national averages, is on the low end. And so having the support of Blue Cross Blue Shield with the Safety Net Grant has really helped us reach folks who otherwise wouldn't be able to access care outside the hospital emergency rooms, where their care would be even more costly. We see a lot of folks who are still uninsured because maybe they make a little bit too much to qualify for Medicaid, but not nearly enough to be able to afford health insurance on their own. And grants like the Safety Net Grant from Blue Cross really help us reach those folks in particular because the cost of their care is even higher.